Будем здоровы!
Ріки, ліси, безмежні поля, це ненавидь рідна земля, мій рідний край, моя земля, тебе навіки кохаю я, мій рідний край.
Welcome! The following video program was produced for the Russian-speaking community to inform and educate on the prevention and treatment of the disease of tuberculosis. Hearing that you and your family member has been exposed to tuberculosis germs can be frightening. Tuberculosis, also known as TB, is a contagious disease that is spread through the air from a person who has active TB disease. TB can be a serious and even deadly disease if left untreated. That is why it is important to get proper medical treatment for tuberculosis.
The purpose of the TB assessment is to identify any exposure to TB and ensure that people are referred into further assessment and treatment if that's necessary. There's a lot of stress involved with resettlement, and without feeling strong and healthy, it's even more challenging to create a new life here that includes finding a new home, finding a job, learning English. It is also important in terms of job clearance, for green card applications. There's a lot of need for TB clearance at different points in people's lives here. There is no cost involved in the TB screening, and then if anything is identified, there's no cost in further assessment or treatment.
Their intention is not to frighten you, but to prevent and treat tuberculosis.
Working with the TB patients, our main concern is for our patients to stay healthy, to take appropriate medications for their treatment. We really appreciate all your questions and concerns, and we respect them. And our main job is to make sure that you would feel comfortable with your treatment, that all your questions about possible side effects and the problems will be addressed.
It is the duty of county TB programs to diagnose and treat tuberculosis in California.
The health department is responsible for education and prevention regarding tuberculosis. It is important that people know what tuberculosis is and get tested, as well as those who have the disease receive what is called directly observed therapy. We follow national and worldwide guidelines that recommend that anyone who has active disease receive medication every day, either in their home, at work, or in a clinic.
Testing for tuberculosis bacteria is done in a variety of medical settings.
When someone is diagnosed with tuberculosis, one of the most important things we can do is determine if someone in their family got the infection or the disease from close contact with that person. The best way to evaluate people to find out if they got the TB infection is with a TB skin test.
TB is the #1 infectious disease throughout the world. It is extremely important that TB patients are properly treated. If people with active TB disease don't take medicines as prescribed, they can spread the disease to family and friends.
For treatment of latent TB infection, it's very important to be on medication because it's preventive. And for active TB infection, it's very important to be on medication also because after the treatment, you're not contagious anymore. Germs will be killed and patient will be cured.
Tuberculosis primarily affects the lungs. It is spread through the air when a person with active TB coughs, sneezes, sings, or laughs. If you breathe in the germs, you may get infected with TB. TB germs, which you cannot see, can stay in the air for hours. It is important to know that you cannot catch tuberculosis by sharing utensils, food, glasses, or by touching another person. There are two types of tuberculosis. One is called latent TB infection, LTBI. The other is called active tuberculosis disease. With LTBI, the germs are sleeping in your body and cannot hurt you now. You feel well and cannot spread TB to other people. When TB germs wake up and start to grow, you have active TB disease, which causes damage to the lungs or other organs. People with active TB disease can get very sick and spread the disease to others.
A person with TB disease might have symptoms of coughing, sweating, particularly at night, fever, sometimes chest pain, either in the front of the chest or the back of the chest, losing weight unexplained.
Anybody can be exposed to TB, but if one person in a group or family has tuberculosis, the risk becomes much greater for other members of that group or family to catch TB. Your greatest risk comes from spending a lot of time indoors with someone who has an active TB disease.
And a positive TB skin test means that the TB germ has got into that person's body. It's very important to protect yourself against what that germ could do, making you sick with TB. But as long as the germ's asleep, you won't feel sick. That's the time to take medicine to prevent TB. And medicine is taken for anywhere between 6 and 9 months to do that. It's important to take all the medicine so that complete prevention is accomplished.
If you have active TB disease, you need to take the medicine as prescribed so that you can be cured completely. If you do not take the medicines correctly, the germs can grow stronger and become resistant to the pills. Tuberculosis germs that are resistant take longer to treat, take more money to treat, and can spread to other people. If you have a TB infection, you can take a medicine to prevent getting active TB disease in the future.
It's very important to take this medication, and it's very important to understand that the medication is very safe. We are talking about 5% of a chance for people to develop side effects, and those side effects are mild. People are usually concerned about liver toxicity, very unexpected. The probability for this to happen is less than 1%. But the benefit of not develop active tuberculosis during your lifetime is humongous. So the ratio between the benefit and the fear of liver toxicity is huge.
One of our former Russian-speaking patients had tuberculosis. She was immediately sent to the chest clinic, and Dr. Pulmonologist talked to her, and she was told that she needs to take medication against tuberculosis as soon as possible. But she absolutely, totally refused to take medication. So because of her refusing to take medicine, she was isolated, and only one family member could take care of her. Unfortunately, she refused to take medicine until she died. Please, never hurt you to say no to medicine. Please make the right decision to take medication. We want you to have a long and a happy life.
Tuberculosis is completely different field of medicine compared to pulmonary diseases, to infectious diseases, and it needs certain expertise. We have physicians and nurses who are specializing in diagnosis and treatment. We have additional training in TB field, and simply because that's the only thing we do. Doctors and nurses who are working in TB control actually better trained in terms of tuberculosis, and they have more experience.
Yes, that's a very good question.
Usually TB clinics are specializing in seeing TB patients from all over the world. So we are very familiar with the cultural issues, we're very familiar with psychological issues.
How do you know if you have TB infection? A simple blood or skin test will usually find out if a person has been infected with TB germs. Many refugees and other immigrants are given chest x-rays to check for TB before they come to the United States. But it's still possible to have TB when coming into the country or to get TB from someone already here in the United States.
Many immigrants to this country have been vaccinated in infancy or childhood with a vaccine called BCG, which is meant to prevent tuberculosis. It isn't a very strong vaccine. Later, when these people are living in the United States and have a positive TB skin test result, they believe that the positivity comes from having been vaccinated in infancy rather than from any tuberculosis exposure. Now, however, there is a new test, a blood test, which does clearly distinguish between TB exposure in the past and having been vaccinated without TB exposure. That's called the QuantiFERON Gold blood test.
Patients are always referred to the county TB program when they are suspected of having TB disease. Referrals come from hospitals, doctors, or other medical providers. Law requires this if active TB disease is suspected. Skin tests or blood tests are done at county clinics.
If a health worker suggests that you have a TB skin test, you should have one. As a health worker, I have a test every 6 months.
There are 2 quick and easy medical procedures to check for TB infection. You may have a tiny amount of harmless liquid injected just under your skin for the skin test, or you may have a small amount of blood drawn for the QuantiFERON blood test. Neither of these are medicines or vaccines, just tests to see if you have been infected with TB germs. After you are given the TB test, you are given an appointment to return and have the test reaction read by trained medical staff.
When you have a TB test done on your arm, you must come back after 2 or 3 days to have it looked at by a health professional. If you don't have it looked at, it's like not having a test.
If you have a skin test, it is important to return to have your skin test read, or you will have to repeat the test. If you have a QuantiFERON test, the blood will be sent to the lab for testing. If you have a positive QuantiFERON blood test or positive TB skin test, you will need the chest x-ray.
With the help of a translator, bring the patient in and have them undress from the waist up and put a gown on. Bring them into the exam room, and again, with the help of a translator, we position them for the chest x-ray. We do 2 views, a frontal view as well as a side view. And while the patient is still here in the clinic, we take a look at the films to see if there's anything overtly abnormal about them. If they seem, to be within normal limits, we let the patient go home. If there's something that's abnormal that the tech is able to see, then we bring it to the radiologist, possibly get additional views. They're able to go home after that film. The procedure for x-raying a baby, we have a piece of equipment that holds the baby still while we take the exposures. It does make the babies cry generally, which is what we want because we want them to take in big lungs full of air so that we get a good expanded chest x-ray.
An x-ray equals about 1 afternoon in the sun gardening or biking, so it's nothing to worry about. On a normal flight from Russia to America, you receive about the same exposure. If you are pregnant or think you might be pregnant, you need to tell the doctors so they can decide when to take the x-ray. Extra precautions are always taken to protect the baby. If your chest x-ray looks like you have active TB disease, the next step is a sputum test. Sputum is the secretion that people have in their lungs and cough up. You will be given a special cup to take home and collect the sputum samples. When people have an active TB disease in their lungs, they will be instructed not to go to work, school, church, or other gatherings for several weeks. This is to protect other people around you from exposure. If you have active TB disease, healthcare workers will arrange for you to participate in directly observed therapy, DOT. You may go to the chest clinic 5 days a week to take medicine when it can be arranged that the health worker visit your home to help you take your medicine. The purpose of directly observed therapy is to make sure you are treated completely so the TB won't come back again. Everyone with active TB disease must take the medicine. If someone with active TB does not take their medicines, they can be isolated to prevent the spread of TB germs.
One question that I am asked frequently is, why do we bother elderly patients to take treatment for LTBI or active TB disease? It is out of concern for their health and for their family members and others around them. All patients are carefully monitored throughout treatment, no matter what age they are.
Members of a household may be started on treatment for TB exposure because it can take up to 3 months for an infection to show up positive on a TB test. Because of the time it takes for an infection to show up, you may need to be tested again.
The problem is that when people have the germs in them that is not active, or it means it's sleeping, they don't feel bad. They feel good, they don't have any problems, so they don't want to take medication, and this is natural. But we know that this germ can become active. So we recommend that you take the medication to kill the germ before it becomes active. And it's very important to take the prescribed medication for the duration that is prescribed to you.
If you are contacted by a healthcare worker regarding TB, please follow all their instructions.
Tuberculosis affects many people, many kinds of people, and we get all kinds of people who come to our clinic. So what we try to do is to make sure that we deliver our services in a culturally sensitive manner. All the people who work with our clients are very respectful.
TB information is confidential. Services provided for Russian-speaking clients include interpreters and bilingual TB handouts. County public health workers meet with members of the Russian community to share information about the prevention and treatment of TB.
You need good health to enjoy your life in USA. It's very important. The best way you can help your family and the Russian community is to help the public health workers to complete their mission of treating TB and preventing it.
We are interested in them staying healthy, and we're suggesting they work with the public health department and their staff who are interested in preserving the health of the community. So when they get any notices from the public health department, or if they're experiencing any symptoms, they should follow up and get tested, so to just prevent the spread of any disease, including tuberculosis.
Tuberculosis is a serious, contagious disease that anyone can catch by breathing in TB germs. TB can be deadly if not treated properly or in a timely manner. If you have been exposed to someone with active tuberculosis disease, get tested. Remember, you can take medicine for TB infection to prevent TB disease in the future. Keep all of your appointments and follow your healthcare provider's instruction carefully. Tuberculosis can be prevented and treated. Do your part to help your family and your community.
Будем здоровы!